a patient has joint pain, the only option for them is typically medication and surgery. And quite often surgery is expedited. They are at a certain point where painkillers are not going to help them. So they go in for a surgery evaluation. The problem with surgery, and the reason why I think it's so barbaric, is because it's the first option, and once you have a joint replacement, you can never go back. You can never go back to alternative therapies. You can never go back to regenerative therapies, because what a joint replacement does, for example, a knee surgery, they actually have to cut bone off of you. The femur and the tibia are sawed off, and then metal screws are put into that joint in order to hold the replacement, the new knee joint in place. Once that is done, there is no other option for you but medication and surgery after that. So what I think is barbaric about surgery is that it's the first option for joint pain, instead of considering an alternative that might be less invasive, less costly, and less painful. And in the long run, completely reverse an underlying condition of degeneration. So with my joint injections, we're actually getting down to the root cause of what's functionally and structurally wrong, instead of going in and yanking it all out just because it doesn't work appropriately, instead of trying to figure out how we can heal it.